Well, I think public opinion is pretty fluid, and it goes back again to your initial question. People are confused. They're not knowledgeable as I wish they were about some of these issues, and so they're influenced by what they see and what they read. Unfortunately, a lot of what they see and what they read is so sensationalized and so hyperbolic. I had in my own experience, I was asked by the AARP and South Dakota Public Television to come back and do a town hall meeting. This was like months before August, and so I said, of course, I'd be happy to come do it. I get home from time to time, and so this is now August, and these confrontational experiences are being widely reported. I get to my hometown where this town hall meeting is going to be held. There are demonstrators outside, and you know, with all kinds of crazy statements on these placards. I get inside, and it's a crowd much like this, and we have the most rational conversation, very good questions. The moderator, like you, has asked extraordinarily insightful questions about all kinds of pieces of it. And the next morning I read the newspaper, and I would say 95% of the coverage in the paper was about the demonstrators and quotes that they had either about me or about health care that were just completely off base. Nothing about the thoughtful, substantive discussion that occurred for an hour and a half in that hall. And that's what's disappointing. I think that the media probably have acted as irresponsibly on this debate as anything I've seen in public life.
But just I don't know. That's an interesting proposition. I've got some examples where I think they may have been worse, but I think that. But doesn't it present a fundamental challenge to our system of democracy that by almost everybody's assessment, you can list an inventory of major problems the way we currently finance and deliver health care, looking at outcomes and all the other things you listed earlier. So the demand for change is there, but the barrier to change, it seems to me, gets erected in this arena where being informed is so important, and it's so easy to misinform. I mean, don't we looking at a major problem with representative government here at this moment?
Well, we are, but I would argue, Bob, that we've had to grapple with that for 200 years. I mean, look at in our lifetime, the civil rights battles of the 1960s and how confrontational they were and how misinformed in some cases they were. Crazy assertions made in some cases. Look at the battles over Vietnam and over the last several years on Iraq. You know, a lot of the big public policy debates have involved emotion, mistruths, allegations, hyperbole, misinformation on the media, and you know, so I don't think from that perspective. I call it the noise of democracy. It's, you know, it's not very stereophonic. It's pretty screechy. It's hard to listen to. It's one of the aspects of democracy that you just have to accept. But what is necessary through all of that, it takes strong leadership from the White House. It takes courage from members of Congress to stand up to those who would distort and destroy the debate, and ultimately work through all of that. And you know, that's the question. Do we have enough members of Congress with the backbone and the vision to allow us the opportunity to move forward on something as critical as health reform in America today? The jury's still out. In the House, I think we could say unequivocally yes. I think what I saw the House do in those three committees, what I think they're prepared to do on the floor, is pretty impressive. And the question is, can we do the same in the Senate?